Alright, thanks for tuning in. We're here with Carla, who's agreed to participate in this video and allow us to do an exam today. She lost over 50 pounds with diet and exercise and has some excess skin and fat of her trunk. She also carried 2 babies to term and had some two C-sections, and we'll see the scars from those when we do our exam. Interestingly, the scars that you're going to see on her in the lower part of her abdomen, those scars will be completely gone when we do this. In this case, Carla lost her weight with diet and exercise, although she reports fluctuations in her weight previously. And the longer someone stays heavier, the older they are when they lose the weight, the more likely they are to see skin excess. Likewise, if we see people who've had a lot of fluctuations rather than just 1 or 2 fluctuations, large fluctuations in their weight throughout their lifespan, we tend to see that as having more skin excess. So in Carla's particular case, we'll see here on exam, we're going to do what's called a fleur-de-lis lower body lift. A fleur-de-lis, Saints fans, who dat may remember that the fleur-de-lis is that shape that the New Orleans Saints have as part of their logo. And it's a French sign, symbol. It's a symbol of New Orleans, I guess. And it's the pattern that we use when we're addressing skin excess above the belly button and below the rib cage. A lot of times when you look at body lifts and tummy tucks, you'll see this horizontal scar. And we try to make that horizontal scar as low as possible to minimize visibility and to conceal that in panty lines. But in some cases, if you get rid of that skin excess from the lower abdomen, it does not address the skin excess of the upper abdomen, not without that fleur-de-lis or vertical scar. So that's what we're going to do here when we do Carla's lower body lift. Of course, lower body lift is a circumferential procedure. It's where instead of, or as opposed to a tummy tuck where the scar ends out here on the outside part of the abdomen or the hips, a lower body lift is a situation that goes all the way around like a belt. The reason we do that is because people in some cases, especially after weight loss, have skin excess that doesn't just exist in the front or on the abdomen. It's 360 degrees. So in this particular case, we're going to do what's called a fleur-de-lis lower body lift, and we're going to be addressing skin excess all the way around her body, and especially in the upper abdomen. So Carla has agreed to allow us to examine her. We're going to open up her gown, take a look at her tummy, and then take it from there. So do your arms like this. Thank you. All right, Carla. So we're going to look right here. If you look, you'll see this vertical scar, which is not the way we typically do C-sections, but you'll see sometimes this with a hysterectomy, or in her case C-sections, that will be completely gone. But she has this area right here, which is, again, this is the umbilicus or belly button, and when we see skin excess in between the top of the belly button and the rib cage right here. So we'll need to address that with a fleur-de-lis, or that vertical scar here, that vertical incision here. And then, of course, the lower body lift will address all the excess skin between my hands, all the way around her trunk, coming to the top of her butt crack, which is where we're going to stop that and meet from both sides. We, of course, will be using liposuction as an adjunct in this case to address some of the excess here, especially along her flanks and sides. One question that we get asked is there muscle work? Do we tighten the tummy muscles with a lower body lift? And that depends. In most cases, we do, especially if a woman has carried babies to term. And has completed her family planning or doesn't plan to have any more children, we will tighten those muscles. We're going to in Carla's case. Thank you for tuning in. We're back with Carla, and she's back after body contouring. She, of course, lost a tremendous amount of weight, and we saw her preoperatively here in the room where we did an exam and kind of talked about some things that we were going to do. We did a fleur-de-lis lower body lift. That, of course, is a circumferential scar that goes all the way around the waist, kind of like a belt. But in her case, the fleur-de-lis just adds a vertical component to that scar. We did that to address specifically upper abdominal fullness. She had some excess skin and fat between her belly button and her rib cage, and that's why we did that vertical scar. In some cases, we find that vertical scar adds a tremendous amount of improvement to the silhouette, and helps the tummy look flatter. So not everybody needs that, but some folks do. In Carla's case, we did that. We also did a thigh lift. So with your permission, we'll do an exam. Okay, so Carla, hold your arms out like this. Very good. We're going to open up the robe here and just look at her tummy. So right now, we can see that that she has this vertical scar here, and of course the scar which goes circumferentially around her waist. But a really nice appearance to her lower abdomen. It's nice and flat here, and a very nice nice tight waist here. And you can see the scar from the fleur de lis comes right around here, and just sort of lifts the buttock, lifts the lateral hips, and of course the thigh lift that she had done also is down here. You can see some of these scars here. These are much fresher. So, but an improved contour in all these areas, and I'm really happy with that. All right, guys, thanks again for tuning in with us. That's it for body contouring. We have a lot of other videos online, and they're on our website at robinsplasticsurgery.com. We also have a great before and after gallery with a lot of different body contouring cases. It's something I'm really passionate about, so please check us out there. Give our office a call if you have any questions. Thanks again.